Hi everyone. This clip is part 3 and a continuation of the summary of your blood test results and what it translates to. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please ensure to consult your healthcare provider. So the next in line is fasting insulin. Normal range for this is between 20 to 180. High or low levels indicates potential health issues. High fasting insulin levels, especially when accompanied by normal or elevated blood glucose, may suggest insulin resistance or prediabetes. Low fasting insulin levels could be a sign of type 1 diabetes or advanced type 2 diabetes, where the pancreas doesn't produce enough insulin. Then we have CA, or blood calcium levels. Normal range is between 8.6 to 10.3. High calcium levels can be due to hyperparathyroidism, certain cancers like lung, breast, or blood cancers, kidney disease, Paget's disease of the bone, and some medications. Low calcium levels can be due to hypoparathyroidism, vitamin D deficiency, kidney failure, low levels of magnesium, pancreatitis, and celiac disease. And next is a set of numbers that work and sort of relate together that you might see on the blood test result. So in that we have CHOL, or total cholesterol. Normal range is it should be less than 5.17. This is sum of LDL, HDL, and other cholesterol carrying lipoproteins like VLDL or very low density lipoprotein, which primarily carries triglycerides. A high total cholesterol number is a red flag, but it doesn't tell the whole story. And we need to look at the individual components. This is where the next reading, which is LDL, comes in. LDL, or low density lipoprotein, the normal range for that is less than 3.36. Often called the bad cholesterol, high levels of LDL can lead to buildup of fatty deposits or plaque in the arteries, which is called atherosclerosis, if I can say it. This can narrow the arteries and increase the risk of a heart attack or a stroke. The goal is to have low LDL number. Then the next one next to it is HDL, or high density lipoprotein, and normal range is 0.59 to 2.38. Often called the good cholesterol, HDL helps to remove excess cholesterol from the arteries and transport it back to the liver, where it can be broken down and eliminated from the body. A high HDL number is considered protective against heart disease. The goal is to have high HDL number, basically. So then comes the ratio and the calculations. So we have CHOL/HDL. The normal range for that is 1.6, actually less than 1.6. And this is a simple calculation where you divide the total cholesterol by the HDL cholesterol. A lower ratio generally is better, as it indicates a more favorable balance of good and bad cholesterol. Then the next one that attaches to these is non-HDL, and normal range for that is less than 3.37. This is an increasingly important number in cholesterol assessment. It's calculated by subtracting the HDL from the total cholesterol. This number is considered a more comprehensive predictor of heart disease risk than just LDL alone. It includes the LDL and other bad forms of cholesterol, such as VLDL, because it doesn't require a fasting blood sample like LDL, which can be affected by the food intake. It's often a more reliable and convenient sort of metric for both doctors and the patient. The goal is to have low non-HDL number. So think of it as this. CHOL is the total number of cars on the road. LDL represents the cars that are causing the traffic jam. HDL represents the tow trucks that are clearing the traffic jam. Okay? And non-HDL represents all the cars causing traffic jams, including not just the bad LDL cars, but other cars that can also contribute to this congestion. Then we have CHOL-HDL ratio, and this is a simple measure of how many bad cars there are compared to good sort of tow trucks. So ultimately, all these values work together to give you a complete picture. While the individual numbers are important, the non-HDL and the ratio can provide a more sort of nuanced understanding of the risk profile that you might be in, especially when considered alongside other factors. Then we have TG, or triglycerides. Normal range is less than 1.7. High triglycerides indicate elevated levels of a type of fat in the blood, which can increase the risk of heart disease and stroke. Conversely, low triglycerides are generally not a cause for concern and can be associated with conditions like hyperthyroidism or low-fat diet. The next measurement we have is magnesium. The normal range for that is 1.7 to 2.2. High or low magnesium levels indicates a potential imbalance in the body's magnesium levels, which can affect various sort of bodily functions. High magnesium is often associated with kidney problems or excessive magnesium intake. Low magnesium can result from poor diet, digestive issues, kidney problems, or certain medical conditions. Again, in the interest of not making this too long, I will continue this in the next clip. Hope this has been helpful. Like and follow for more. Be the light.